is Alan Wink, and I'm the Managing Director of Capital Markets for EisnerAmper. It is my pleasure to welcome everyone to the PACT Capital Conference 2020, Day 2 of featured company presentations in the early stage category. We are excited that you are here to see these great company presentations on the road to the Lion's Den.
New this year, we're giving all of you the opportunity to rate our featured companies. This will help our Lions determine who will be the final 3 on September 24th. To access the ratings, open the PACT Capital Conference app on your mobile device or desktop. Again, you can use your mobile phone to scan the QR code that's on the screen for quick access. Once you've logged in, the access code to join is CapCon 2020. Again, CapCon 2020. In the Featured Companies tab, select the company you'd like to rate and rate it from 1 to 5 stars, with 5 as the best. You can rate as many companies as you like. We will close the rating function the week of September 14th. Again, help us guide the Lions in choosing the final 3 companies for the Lion's Den of the PACT Capital Conference on September 24th.
Before we get started, I just want to thank all the sponsors of the conference. We could not pull off such a fabulous event without your help. I'd like to give a special thank you to the industry track vice chairs, Healthcare, Kapila Ratnam, General Partner, New Spring Capital, Technology, Glenn Bressner, co-founder and managing partner of Activate Venture Partners, and early stage, Doc Pargi, managing partner, SRI Capital. At this time, I would like to introduce a short video on EisnerAmper, the global accounting and advisory firm.
I was asked to come back and help our firm develop a cloud accounting practice. The name of the division is EisnerAmper Cloud Accounting. We provide cloud accounting services for small to mid-sized businesses. It concludes everything from entry-level bookkeeping, bill pay, accounts receivable management, reporting analytics, consolidation, multi-currency. I think the thing that's unique about EisnerAmper is that we kind of bridge the gap between personal wealth and business wealth. So, I like to say we take care of small companies and their owners. I mean, we also take care of public companies as well. We are a big firm, but we really come down market very well and give the small business, complete support. At the core of our offering is Xero. It's a great application that can connect to whatever we'd like it to connect it to. Some of our go-to apps are Bill.com and Expensify and Gusto. Those seem to be on most of our client implementations. But we also, depending on the industry you're in, we work with other third-party apps that are available on the Xero store. So there's project management type time capture systems. We do a lot in financial services. Our offering is very different. At the beginning, the first call with the client, we have a project manager as part of the team who actually leads the first couple months of the implementation of the solution.
So one of the great things about the EisnerAmper Cloud Accounting is because everything is automated and streamlined, and we have an extremely close relationship with these clients, we're available to advise them in their needs for growth, for finance, any expansions or mergers and acquisitions that they may be interested in as they go through their business cycle and through their successes. The most rewarding part of my job at EisnerAmper is seeing our clients grow and succeed.
Now join me in welcoming Andy Cherry, partner with KPMG. Thank you very much.
I'm Andy Cherry from KPMG. I'm on the board of PACT, and my firm is proud to be a founding sponsor of the organization. KPMG is a global audit, tax, and advisory firm. One of our key strategic channels is our private markets group, where we assist emerging growth companies at all stages of their life cycles with their audit, tax, and accounting needs. I'd now like to introduce the early stage track and attorney Brian Slaw of Morgan Lewis.
Welcome to Day 2. My name is Brian Slough. I'm an attorney at Morgan Lewis. Morgan Lewis is a proud sponsor of this event and a strong supporter of the startup community. Now, let's hear from our early stage presenters. Our next presenter is Ricovr.
Hello everyone, my name is Himanshu Bhatia. I'm the CEO and founder of Ricovr Healthcare. About myself, I'm a medical doctor by background and have worked as a research scientist across a number of prominent universities in the US. Started from the MD Anderson Cancer Institute in Houston, Texas, to Albert Einstein College of Medicine, the University of Pittsburgh, and then the Roswell Park Cancer Institute. Across my scientific journey, I was fascinated by the great science that happens in the labs, but a very few of those make it to the commercial space. And that's what got me interested to pursue my MBA. I went for my MBA at the University of Rochester, after which I worked for a couple of medical device companies and launched a few products within the US and in Europe. Besides my full-time work at Ricovr, I'm a huge music enthusiast and I play the guitar and the piano. And I love to spend time with my wife and my son.
Hello everyone, this is Himanshu again. This time I would like to start by introducing my co-founder Piyush. Piyush?
Hello everyone, my name is Piyush Sadana. As you can see, I am not a guitar player, but Himanshu is teaching me, so thanks for that. So my background is I'm an engineer turned investment banker turned entrepreneur. I went to Columbia Business School, did investment banking with the world's largest sovereign fund, and then was involved in scaling up 2 early stage companies in AI and travel tech space. And I joined Himanshu in this exciting journey.
Thanks, Piyush. So really, I'd like to introduce our company and what we're doing. So at Ricovr, we are building a point-of-care rapid detection device that uses saliva as the diagnostic medium. Why saliva? Because saliva has a lot of information that has not been harnessed. And that was really the thesis of why we started Ricovr. We found this very fascinating and differentiated technology that can pick up analytes at a very low levels. And so we started our work on drug of abuse detection. And we got a very huge interest from different segments like the employers, the law enforcement, the healthcare facility, as well as the government. Here's our management team. We've already introduced both of us to you, but as you can see, we have a very strong scientific, marketing, and sales team and have a strong legal support. Just want to mention about our advisory board. We have a very prominent board that has Surya Mohapatra, the ex-CEO of Quest Diagnostics, Ben Baldanza, the ex-CEO of Spirit Airlines, and Kevin Quinn, the ex-senior partner of Goldman Sachs. So when we started our work on drug of abuse detection, what we saw was that marijuana legalization was expanding. And because of that, there was a number of problems that employers were facing, including rising insurance costs, more legal liabilities, as well as reduced productivity at their workplace. Our device is something that's very simple to use for anyone at the workplace, and here's how it works. You take a swab, take a few microliters of saliva, push it into the syringe that deposits that onto our sensor, and then you show a quantitative readout on the device. We have our technology protected by multiple patents worldwide. We are in a huge growing market opportunity with over 46 billion point-of-care diagnostic device. And in fact, there's a growing interest in saliva tests because of the COVID situation. And the market is expected to grow at over 4% CAGR. Our go-to-market is not just the employers, which includes the construction and the trucking industry, but also the law enforcement, the medical professionals, and also the consumers who would love to have an inexpensive method to test at the spot if a person has consumed marijuana or not. A quick look at our competition. As a general way, competition is divided into the saliva and a breath-based detector. Breath-based detectors have not shown to be as accurate, and just at a high level, ours is a very unique, sensitive, and low-cost technology compared to others. We have completed our prototype and are working towards our commercial device. And later this year, we plan to launch our alpha version. And next year, we want to get into the market with our device. Besides THC testing, we have also worked on looking at how we can use the same technology for COVID testing. To that extent, we published a scientific paper that got accepted in the Springer Journal, and we filed a patent based on that. And in fact, we got an LOI for 75,000 tests from a few customers. We also got an interest from the Department of Defense and have recently won 100,000 grants from the US-India collaboration.
Revenue model is that the reader, we want to keep it under $500, and the cartridge, which is needed for every test, we want to keep it under $10. Even with these unit sell prices, our gross margins are actually pretty good. On funding side, we are looking to get to market and looking to raise a 1.2 million seed preferred round. We need this money for R&D, manufacturer scale up, and regulatory approvals.
So as we have already proven with THC and COVID, our device is capable of doing much more. And these are some of the future opportunities that we see a possible expansion of our device into cancer, prognosis, and many other fields. Thank you.
Our next presenter is Cassian Soutions.
Hi, I'm Chris Corsi, CEO and co-founder of Cassian Soutions. I went to the University of Pittsburgh for both my graduate and undergraduate degrees in computer science, and I grew up in the Philadelphia area my entire life. Outside of Cassian, I love going down to the Jersey Shore for a good beach day and playing some golf and surfing while I'm down there. It was nice to meet you guys and hope to talk to you soon.
Hi, I'm Chris Corsi, the CEO and co-founder of Cassian Soutions. Cassian provides best-in-class patient engagement for specialty therapies. Cassian's patient engagement engine, Flex, fills the critical gaps in the specialty patient journey through automated and individualized patient engagement that improves compliance, patient reporting, and helps patients stay on therapy. Cassian has identified a pain point in the specialty pharmacy and drug manufacturer value chain. This is specifically in the post-approval state for patient data collection and outcomes data collection. What's interesting is that currently in specialty therapeutics, pharmaceutical brands will pay anywhere between $300 to $1,500 per patient per year to monitor their patients. The current process is manually intensive and not scalable. What's worse is that 83% of these manufacturers said that they would like to see improved adherence, improved data services and reporting, and then finally improved customer service. Today, there are 30 million patients that are classified as specialty patients, and we believe our platform can address 8 to 12 million of these patients. There are over 1,000 specialty pharmacies that exist today, and there are over 1,700 orphan and specialty drug manufacturers. So all in all, the total addressable market is $2.8 billion for patient engagement and data collection in the specialty drug space. Let's look at our competition. We can see there are a few platforms out there today that do a good job at individualizing patient care, like WellFrame and OptimizeRx. However, they don't directly align with the specialty pharma market. There are regulatory requirements in the specialty space that our software meets that is a barrier to entry for these other software competitors. Our system was built from the ground up with specialty therapies and high-touch diseases in mind. When we think of our landscape, our three uniques as a company are, we always provide the patient with the right communication at the right time. We always provide real-time insights from high-quality data, and we make it easy to get started. Pharmacies and pharma brands can start within 1 to 2 weeks engaging with their patients. To do this, we have created a state-of-the-art patient engagement engine. What our system does is it intakes a patient's disease and drug. It then automatically curates individualized patient engagement content and automatically outreaches to the patient, thus removing the manual effort of an FTE to engage that patient. Patients now engage over SMS or email via our web app or through our mobile application. They are able to reply to clinical assessments, see pharma branded content, or even see educational material. Through these interactions, we are able to collect this data that they are reporting themselves, as well as the passive data and how they're interacting through our system. Through these two different streams, we're able to standardize all of this data, pull out the patient insights, and report that back to the pharmacies and care providers so they can intervene when necessary. Currently, we have 2 pharmacies utilizing the Flex platform on hundreds of patients. They are using it to engage their patients specifically through collecting clinical assessment data. This is allowing them to push more disease and drug-specific assessments and allowing them to reduce their overall burden on their pharmacy staff. Looking forward, we have 3 enterprise opportunities as well as 1 specialty pharmacy we're looking to close in Q3. To get a sense of customer size, we expect a small to medium-sized SP to generate about $18,000 to $25,000 of annual recurring revenue. And on the enterprise side, we expect these businesses to generate a minimum of 250,000 ARR with the potential to grow to 1 million ARR. The way we are capturing this market and going forward, we're planning on continuing to capture the small to medium-sized SPs. As we grow, we plan to continue going after the enterprise deals as well as the pharma brands themselves. This year, we are primarily focused on growing the number of subscriptions to our Flex platform. The goal is to bring as many specialty pharmacies and pharma brands as possible in order to help them streamline their data collection capabilities. Going forward into 2021, we plan to launch another product called MetaTrack. Meanwhile, we will continue to grow the Flex platform in the specialty pharmacy and pharma space. In 2022, we plan to start approaching CROs and enter the clinical trial space. Then in 2023, we plan to see continued growth for both of our platforms in the specialty pharmacy, pharmaceutical manufacturer, and clinical trial spaces. We have a great multidisciplinary team with team members from CMU, Columbia, and Pitt. I'm Chris Corsi, the CEO of Cassian Soutions, and my background is in operations and data science. I worked at Lockheed Martin, managing large teams of systems and software engineers, as well as managing large software deployments and a $25 million annual operating budget. Cassian is currently raising a $1 million seed round. Ben Franklin Technology Partners has completed a full diligence report on our company that we are able to share, and they have committed capital into our round. Currently, we have $300,000 committed, and we're looking for an additional $600,000 to be committed. Thank you. I'm Chris Corsi, and I'm looking forward to speaking with you soon.
Now, please welcome DriQ Health.
Good morning. My name is Gregory Dean. I'm an entrepreneur and a physician, and I'm the founder and CEO of DriQ Health. I received my medical degree from Columbia University, where I went on to receive my urology residency training and then went on to become a pediatric urologist. My whole life has been focused on the management of urinary incontinence. When I saw an adult family member in a nursing home, I saw that the biggest need for urinary incontinence was unmet. In these nursing homes, when patients become wet, there is no system in place to notify the staff that their adult diapers need to be changed. With this in mind, I founded DriQ Health, the world's most advanced adult diaper incontinence detection system. There are 1.7 million Americans in nursing homes who are incontinent. Urinary incontinence is a massive drain on the US healthcare system. It's directly associated with falls, which carry a $50 billion price tag. It's also associated with skin breakdown, ulcers, which carry a $10 billion price tag. I'm pleased to report to you that DriQ Health has solved this problem. We've created an operating system for monitoring urinary incontinence. Our system consists of hardware, which includes an external RFID tag, which is on the outside of the diaper, a hub which connects to the cloud, and a reporting system which includes artificial intelligence analytics, as well as an actionable dashboard. As someone who's worked in healthcare for many years, I knew what it would take to create the world's most advanced moisture sensing system. It had to be comfortable. I didn't want to have a sensor which was in contact with the skin. It had to be easy to use for the staff. I did not want there to be a rechargeable battery. I also knew that it would have to be attractive to nursing home administrators. It had to be scalable, and with this in mind, it had to be built on robust IoT backbone. Additionally, because of new remote patient monitoring codes eligible through Medicare, I knew that it would have to be compliant. To create this advanced solution, we turned to RFID moisture sensing technology. No other moisture sensing company in the world uses this technology, which doesn't require a battery and is present on the outside of the diaper, which makes us extremely comfortable. Additionally, it can be disposable. Our hub, which connects the RFID sensor to the cloud, is also revolutionary. Our hubs have direct cellular connectivity. What does this mean? You can take this thing, plug it in anywhere in the world, and it will work. We wanted to create an easy-to-use, actionable dashboard. It provides real-time data for the nursing staff. We've also created performance metrics for nursing home administrators. And finally, we've created reports which can be sent off to physicians. This allows them to be reimbursed using the new Medicare remote patient monitoring codes at $125 per patient per month. I've been to several nursing home conferences and we've received massive interest with regard to our system. Why? This adds significant value to the nursing homes. They know that it will improve patient health outcomes. It's going to improve patient and family satisfaction. It'll decrease infection risk, an important thing in this time of COVID. They won't have to have staffing to mindlessly change diapers every 2 hours. And finally, they know that their referring physicians will be eligible for $125 per patient per month payment. We spent the past several months talking to our potential nursing home clients and developed our business model, which they're very happy with. It consists of a $199 hardware charge and a $59 per month subscription. What does this translate into? It supports us and it supports our investors. Each nursing home, which averages 150 patients per home, will yield approximately $100,000 per revenue per year. There's 16,000 nursing homes in the United States. We've been very busy since founding our company in March of 2019. We completed an $850,000 angel round, which we then used to develop our hardware. We've met all of our design milestones. We've completed our IoT RFID integration, our antenna optimization, our software design. We have working dashboards in place. We have completed our initial regulatory pathway, including FDA Class 2 registration. We're engaged actively in commercial discussions, including 2 with European diaper companies, nursing home chain discussions, as well as forming a user experience trial, which we're about to embark on. We're raising $3 million as a Series A round. We will apply this to further developing our sales force, our support services, our marketing services, and we'll continue our research and development to add additional features over the next few months. We have a wonderful advisory board consisting of world-renowned urologists who are experts in the field of urinary incontinence, as well as geriatricians. We have a very strong management team consisting of myself, Mia Gonzalez-Dean, who is a seasoned healthcare executive with many years of experience at the Hospital of the University of Pennsylvania, as well as with Sodexo. Keith Wilson is in charge of our regulatory pathway, and we also have Vasilios Nassis, who's been involved with our technical development. Thank you for listening to this presentation. DriQ will transform the lives of seniors living in nursing homes.
Next up is My Virtual Vet.
Hi, I'm Felicity Johnson, and I'm the founder of My Virtual Vet, which is a marketplace that connects pet parents with veterinarians for video and chat appointments. I started My Virtual Vet while earning my MBA from Wharton, but I've been involved within the animal space for many years. When I was in high school, I started volunteering at a no-kill animal shelter for my senior project, and I continued to volunteer at no-kill shelters throughout college and while working after college. Prior to Wharton, I worked as a software engineer at Rent the Runway. While working in New York, my cat Tiffany was diagnosed with cancer. I found it incredibly difficult juggling bringing her to her appointments, scheduled for the middle of the day, and my full-time job. I often wished that I could have scheduled a virtual appointment, particularly for her follow-ups, but the option just didn't exist. So I decided to create My Virtual Vet to help other pet parents access virtual veterinary care. Roughly $28.5 billion was spent on veterinary care in 2018, and pet parents continue to spend more every year. When surveyed, more than 50% of pet parents say that convenience is a top priority when selecting a veterinarian. But veterinary care is incredibly inconvenient. Pet parents often need to take time out of their workday to bring their pet to the vet. And frankly, these in-person visits aren't always necessary, but there's just no widely used alternative. From the veterinary supply side, more than 50% of veterinarians would not recommend becoming a veterinarian. In large part, this is because veterinarians are massively underpaid, with the median salary of only $92,000 a year. My Virtual Vet creates a new way for pet parents to access veterinary care and creates an opportunity for veterinarians to augment their income by offering appointments through My Virtual Vet. Pet parents can view all of the veterinarians available on the platform and select the one that meets their availability, specialty, and pricing needs. The platform handles payments, marketing, scheduling, and record keeping on behalf of veterinarians so that veterinarians can focus on what matters most, providing quality care. COVID has presented a tremendous opportunity for telemedicine in the veterinary space. Prior to March 24th, in order for a veterinarian to be able to utilize telemedicine, they needed to have physically examined the animal within 1 year for that specific issue to then subsequently prescribe or diagnose via telemedicine. On March 24th, the FDA suspended this regulation in an effort to encourage telemedicine and therefore social distancing when possible. While it's still decided on a state-by-state basis, many states have decided to follow the FDA's guidance, and this has been incredibly helpful for both pet parents and veterinarians to experience firsthand the benefits of telemedicine. My Virtual Vet allows veterinarians to decide how much they wish to charge for the services that they provide. The platform receives a $5 appointment fee and 30% of the remaining fee paid by pet parents for every appointment. The platform also receives revenue for every prescription filled through our partnership with Vets First Choice. My Virtual Vet is growing the two-sided marketplace through several marketing channels. We have digital marketing as well as building out partnerships, and we're growing our community engagement via a blog and Ask Me Anything Instagram feeds. My Virtual Vet has seen fantastic growth. The number of users has grown over 800% since March, and our conversion from downloading the app to scheduling an appointment is over 26%. There is no clear winner in the telemedicine space, but what makes My Virtual Vet unique is that we are a marketplace, and for veterinarians this is tremendously powerful, as seen by the fact that 90% of appointments done through the platform are with new clients for the veterinarians. My Virtual Vet is also differentiated in that we onboard practices as well as independent contractors to offer appointments through the platform. The team consists of individuals with expertise in software engineering and marketing. We've also brought on advisors in veterinary care and financing to round out our expertise. My Virtual Vet is raising with the intention of putting the proceeds towards increasing our marketing efforts, expanding our technology, and converting some of our part-time workers to full-time. Pet parents and veterinarians have loved their experience with My Virtual Vet. And while COVID certainly was the catalyst that caused pet parents and veterinarians to consider telemedicine, the benefits they've experienced are so vast that we are confident that this behavior is here to stay. Thank you.
Now, let's hear from Myota.
Hi, this is Steve Ray. I'm the CEO of Myota, a SaaS-based cybersecurity startup located on the main line. It's great to be at the conference. I'm going to imagine that you didn't expect to hear three phrases within one of these profiles: entrepreneur, pop-pop, and baseball player. But here I am. Indeed, I've been part of the Philadelphia startup community for the better part of 20 years and lived many of the ups and downs. My wife Linda and I are blessed with 4 children, 3 grandchildren so far, and of course the master of our house, our dog Tucker. And yes, I still play real baseball. You know, I see many similarities between baseball and startups. You've got to really anticipate the next play. At the same time, you've got to learn from every experience. And most importantly, you have to execute in the moment. We're really pleased to be part of this conference. Hope you have a great conference experience, and be well. I'm pleased to introduce Myota to the participants in the 2020 PACT Capital Conference. 2020 has been a year for the ages. I don't think anyone would deny that. You know, I've joked recently to friends that it feels like every week we fill out another box in the apocalyptic blackout bingo card. But 2020 has also seen the emergence of a number of different themes. Amongst those are immunity, and resilience, because after all, who wouldn't want more of either? That's also true in the cybersecurity world, where experts are really moving these two themes, immunity and resilience, to the forefront in the face of an ever-increasing cyber threat landscape. But above all, ransomware has really truly emerged in 2020 as the #1 cyber threat for businesses. Ransomware damage costs to businesses are projected to exceed $20 billion by 2021. As businesses start to move more of their workloads and data to the cloud, that has become a core target for ransomware attacks. And ransomware attacks about 3/4 of the time are successful in encrypting the data that they seek. The frequency of attacks is now approaching 1 every 11 seconds, and the average cost of each attack continues to increase substantially. That's where Myota comes in. The magic of Myota is that we believe if you change the data, you change the rules of cybersecurity. Here's what you should know. Myota protects at the user device and storage level with a dual-layer cyber resilience platform that leverages a patent-pending shred and spread data distribution methodology. To the user, it's intuitive and invisible. To the administrator, we give fine-grained control and also restoration capabilities. Myota renders stored information virtually useless to attackers while enabling data and storage restoration capabilities to the enterprise. And our ecosystem vision will accelerate future growth. Myota boosts enterprise immunity against ransomware, cloud failure, and data breaches, 3 critical points of vulnerability for today's business. In the age of digital transformation, unstructured data is the expanding risk to businesses. Why? Because it's 80% of all data that's managed within an enterprise. It's the lifeblood documents of a business, the contracts, HR documents, financials, intellectual property, and strategic plans that become toxic in the wrong hands. They're often unprotected. They've proliferated over the course of the last few years, and therefore it's no surprise that this vulnerability is a growing issue for CISOs, CIOs, and CFOs. That's why Myota addresses key C-suite needs. The security and visibility are critically important to CISOs. The resilience and control match with the needs of the CIOs. At the enterprise level, the CEO and CFO will see the value of the security, resilience, control, and visibility that reduces the risk of data loss and loss of continuity to their businesses. Myota will have a differentiated launch positioning for IT and cybersecurity executives within mid-market and large-cap enterprises, because we'll provide exponential information protection of unstructured data files, boosting immunity and resilience from ransomware, cloud failure, and data breaches. We're going to target high-need, high-value verticals. Our market penetration and customer expansion will be a SaaS model of B2B enterprise focus down 3 different vehicles or pathways. Direct and inside sales will target 5 verticals, CISOs and CIOs in large cap enterprises. Our channel partners will look at integrating us with managed tools and services for mid-market enterprises and global markets. And our ecosystem partners will integrate us as an offering within their cloud app and drive ecosystems to accelerate global deployment and uptake. Our team is focused upon innovation and growth. Our development team includes experienced product builders. They have built a fantastic product ready for commercial launch later this year, and we will begin to expand our commercial team to prepare us for that journey. With that in mind, that is the focus of our current round of fundraising. We are looking for $1.5 million as a bridge round to complete the current bridge to Series A. It will focus upon commercialization build out, and we are interested in participation of a syndicate investor if that is preferred by a group of investors. Myota is pleased to be part of the 2020 PACT Capital Conference, and please contact us if you have any further questions. Thank you.
Our next presenter is Pippy Sips.
Hi, I'm Amberly Venti, CEO and co-founder of Pippy Sips. I was born and raised in Mill Valley, California. I'm one of the few people that can say they were born in Mill Valley. Yay, home births. I grew up doing modern dance, which brought me many good things in my life. When I was ready to go to college, I went to GW University to major in modern dance, and I was brought one of those good things. I met my husband and now business partner in a contact improvisation dance class. For those of you who don't know what contact improvisation is, it's a form of improvisational dance where you build trust with your partner through weight sharing, lifting, and movement. We have now lived in Philadelphia for about 15 years with our two lovely daughters, ages 4 and 8. Hi, I'm Amberly Venti, CEO and co-founder of Pippy Sips. My company has created Maya, the award-winning system for cooling, transporting, and monitoring breast milk. In the United States, most moms do not breastfeed for as long as recommended. A big reason for that is the challenges breastfeeding moms face when they return to work, including the challenge of safely storing and cooling milk all day. I know all about that challenge. After maternity leave with my second daughter, I returned to running a busy mental health clinic in Kensington. I would pump milk in between seeing patients and managing every kind of crisis. I often couldn't access the shared work fridge because it's where we did group therapy. And my cooler was a poor substitute. It was bulky and I had to pray every day that it worked right. There had to be a better way. One day, in a moment of pure exhaustion, I looked at my Swell water bottle and thought, why do we have these convenient, reliable products for beverages, but nothing for breast milk? Why isn't there something like that? Well, now there is. Meet Maya. Maya is an all-in-one system that optimizes the process of cooling and transporting breast milk. It's thermos-sized and easily fits in mom's purse or pump bag. Using a vacuum-sealed shell and uniquely shaped cooling mechanism, Maya actively chills milk for over 12 hours and keeps it a safe temperature for over 24. Want to be sure? Double tap the LCD screen to see the temperature display. The inner plastic bottle is light, BPA-free, dishwasher safe, and holds over 12 ounces of milk. Finally, we're proud to say that Maya is being built here in the US. We've raised enough money to finance our first production round of 500 units. We've gotten this far through a combination of bootstrapping, crowdfunding, a grant from Ben Franklin Technology Partners, winning a design competition, and an investment from our accelerator program at the University City Science Center. We have a pending utility patent and will be applying for a design patent. Also, I've been a frequent speaker around town and have gotten great publicity from local media like the Philadelphia Business Journal, Billy Penn, and NBC 10 News. Before we started designing Maya, we conducted consumer surveys. The results confirmed that I wasn't alone in wanting a better way to store and cool breast milk. In fact, the majority of respondents felt the same way. Fast forward a couple years, and we now have the opportunity to market our product to almost 4 million new moms every year in the US alone. Moms put pumps and other breastfeeding accessories on their baby registry even before they give birth and know if they're going to be able to or want to breastfeed or pump. The global breast pump market is big and getting bigger and dominated by demand here in the US. Tens and thousands of moms are spending several $100s just on pumps that add promised convenience. In this space, price is not really a deterrent if it makes pumping easier. We're selling Maya direct to consumer online through our website. Our marketing dollars are going towards pay-per-click ads, SEO, and social media influencers with domain expertise. For example, one influencer we're working with is a NICU nurse. As part of future production runs, we'll be making extra cooling pucks and plastic storage bottles that moms will buy for added convenience. Now, who's going to buy Maya? Because of COVID-19, we've narrowed our target audience, focusing on healthcare workers, teachers, service women, and essential workers of all kinds. These moms are not working remotely, and for those who are breastfeeding, it's never been more important to have access to a device that can safely store breast milk away from home. Breastfeeding accessory companies are increasingly seen as good investments and acquisitions. In just the last few years, all of the picture companies received 6, 7, or 8-figure investments, and 2 were acquired, one of which for $140 million. Here's the Pippy Sips team. We like to joke that officer positions were assigned out of necessity and nepotism. The truth is, we're one of the many family businesses that work seamlessly when you have the right family members involved. Together with our advisors, the Pippy Sips team has decades of experience in key areas like lactation science, early stage company growth, legal practice, and engineering. We're raising $500K and looking for a lead investor. Between that investment and the revenue it generates, we can fund 2 rounds of productions and substantial marketing efforts. Most importantly, we will be able to position Pippy Sips to scale in a dramatic way. Thank you for your time. My co-founder and I look forward to hearing from you and any questions you may have.
Wow, thank you for those presentations. I cannot wait to see who makes the Lion's Den on September 24th. I will be tuning in. Make sure you do too.
Thank you, Brian and Morgan Lewis. That's a wrap for our featured company presentations. Today's session and all of our featured company presentations will be available on PACT Now, our digital network hosted on YouTube. The Lion's Den now has a tough task to pick the top 3 companies to invite. I can't wait to see who makes it to the finals and if any of them come out alive. Again, the grand finale, Lion's Den, is on September 24th from 10 to 11:30 a.m. and you're not going to want to miss it. You can now once again head to our PACT Remo room where you can connect with one of our sponsors or one of the featured companies that just pitched. Just follow the link that can be found in your email invite or on your desktop or mobile Capital Conference app. Thank you and enjoy.